The role of a vascular surgeon is to create and maintain a long-term permanent dialysis access in the patient. That could be from placing a catheter at the initial start of dialysis to the creation of a fistula or graft in a patient's arm or placement of a peritoneal dialysis catheter in the abdomen. Dialysis is a process that helps clean the patient's blood after patients' kidneys have failed. Kidney failure is often due to high blood pressure, diabetes, or other natural causes.
With dialysis access for hemodialysis or blood dialysis, there's basically 3 ways to do that. You need a way to get blood out of the body to wash it in the kidney machine and then put it back in the body once it's done. You can have a catheter or you can have a tube implanted underneath the skin that's used for that. There's 2 ways to make the tube. One is with your own veins, which is a fistula. The other one is to implant a synthetic tube, which we call a graft. In most patients, we're able to get a fistula, and that's our goal because it's your own natural tissue. It's what the National Kidney Foundation recommends, and with our experience, we're able to get that done in most people. Even though it's a little bit of extra work to begin with, in the long run, it's much better for patients.
There's really 2 main types of dialysis that a patient can have. The first one is hemodialysis, which requires the creation of a fistula or a graft either in the upper extremities or the lower extremities. The second option is peritoneal dialysis. This one's a little bit different. It requires the placement of a soft catheter into the inside of their abdomen. And the way it works is that the inside membrane or the lining of the abdominal cavity acts as a natural filter.
Dialysis is important because it replaces some of the primary functions of your kidney. The first is to remove toxins that build up in your body throughout your day. The other important purpose of dialysis is to remove extra fluid that builds up your day. As your fluid builds up, you will start to feel pretty poor. You'll become short of breath, you'll become very swollen.
After your dialysis access procedure, it's very common to experience some swelling, bruising, and pain. This should resolve over the 2 to 3 days after surgery. It's uncommon, but we sometimes do have patients that develop pain or numbness or loss of function in the hand, and that can be a sign that the access has too much flow and the hand is not getting enough flow. Certainly if you do experience trouble with the hand, we urge you to call the office right away.
The best thing that I can advise to patients is that as long as you have a good relationship with the nephrologist and your vascular surgeon, we're able to get you through the entire process, through the highs and lows, but we can definitely be there with you all the time, step by step, to try to make that as pleasant of a situation as possible.